Hello everyone, good afternoon. You're probably asking yourselves, what is the exact definition of occupational therapy and what an occupational therapist does? However, before we get into the exact terminology and what an occupational therapist does, let us associate a couple of fundamental basic definitions that go along with occupational therapy. First, occupation is a term that means a self-identity that is given to a patient or a client. Then you have action, which are things that you associate with the occupation. And then lastly, you have tasks, which are the units of the action. And all these three terms are important for us to define what an occupational therapist is. Now, an occupational therapist, exactly according to the AOTA, is defined as using any goal-directed therapy to help improve the patient's independent functioning. And this can be in a variety of settings. This could be in areas of occupation, which can include your activities of daily living, your work, your pleasure, your life, or it can be even a purposeful activity. And this is important for patients and clients because the patient and client needs to become independent, whether it was from an accident or they were born with physical disability or trauma. They need to be able to function in ways that are better. And the occupational therapist, what they do is they can do preparatory activities, which is how the occupational therapist physically or mentally allows the client or patient to be prepared to do the task at hand. And then also the occupational therapist can use a contrived activity, and this is where the occupational therapist uses a made-up activity. So let's use an example in this case. Let's say that you have a client or patient that had a severe stroke and you want to improve their fine motor skills. Well, let's say the client used to know how to play the guitar. You wouldn't use fine motor skills immediately to improve the guitar. You'd use some other skills and methods to help them improve their fine motor skills before they're able to grasp the guitar at hand. And then lastly, the occupational therapist also uses occupation-centered, and this is where the patient or client uses the activities that are natural in their setting. So for example, let's use the guitar scenario again. Let's say that the client improves their skills and they're able to use the guitar to improve their fine motor skills. Well, the occupational therapist may be able to help the client in the natural setting by giving the client or patient their guitar, the exact same one and the same type that the clients had for the last couple of years or so. Also, occupational therapists work in a variety of healthcare settings, and these include inpatient hospitals, outpatient hospitals, and this includes rehabilitation, psychiatric wards, and also the clients range from pediatrics to geriatrics. So an occupational therapist can work with a variety of clients and patients, and the occupational therapist also has to have good rapport, which means a good relationship with the client. And this is important because as the occupational therapist guides the clients and patients through the rehabilitation process, they need to have trust established and be there to motivate or to educate the clients and the patients. So that's all there is to occupational therapy, and as you know, there's probably a lot more I could talk about, and there's a lot more theories out there in regards to occupational therapy. However, that's all for today. Thank you and have a very good day.